Hi everyone, my name is Marwa and I'm an international medical graduate currently doing my master's in public health, and it's my second year concentrating in epidemiology. Uh, so um, During my internship, I did my internship in Children's Advocacy Alliance, which is a nonprofit organization focusing on children's health and wellness, education, and child welfare. So during my internship, my responsibilities were to focus on top three childhood chronic disease in Nevada, specifically in children in Nevada. The aim and the purpose of this um, disease were to find out the disparities in children and to find out the prevalence in these children, um, uh, to inform strategies that improve health outcomes for Nevada's youth by emphasizing collaboration with healthcare providers, educators, and policymakers. So a quick introduction on top three childhood chronic disease, which is asthma, diabetes, and obesity. So why is it important and why the organization wanted to focus on this disease is because it impacts children physical, mental health, and school performance, and also their future well-being. I focused on making the pagers to inform the community school-based programs for awareness and for the prevalence of these cases. So the method of collecting data and the data sources were specifically some sources like CDC, WHO, like World Health Organization, American Academy of Pediatrics, and some peer-reviewed public health studies. And also the data that we were focusing on collecting was to compare the data of Nevada to the national trends and focusing on children aged 2 to 19, and also gathering some demographic information, including race, age, and geographic location to assess the disparities. After like searching the data, we compared the Nevada's data with the national statistics to identify trends and area of concern, assess the impact of race and age on disease prevalence and outcomes, and also evaluated the geographic disparities to identify the high-risk communities. And also examining the role of lifestyles, environmental, and genetic factors in disease development to assess the risk factors. And lastly, identifying common comorbidities associated with each chronic diseases. So after collecting the data from these sources, the results that we got, the asthma's prevalence were 9% in children in Nevada, which is higher than the national rate, and then the national rate is 8%. And then also in the demographic disparities, the African American children have higher prevalence of asthma, followed by Hispanic children, which is 10%. And also asthma, 30% of affected children miss at least one school day monthly, which is a lot. And every month, the specific reason is just asthma. And also the health outcomes nationwide, asthma leads to approximately 200 pediatrics deaths annually, which is a huge number. And obesity, so this one is the prevalence for obesity was also 20%, which is again higher than the national rate. And then it's 90% is national rate, and in Nevada only it's 20%. And the demographic disparities, the prevalence in children were higher in Hispanic race, which is 25%, followed by African American, which is 24%. And also those children who are higher, they are having a higher risk of type 2 diabetes and heart disease if they're affected by obesity. And also, according to WHO and CDC, the projection of obesity rates would be 57% of today's youth children may be obese as an adult by 2050, which is almost half. And also the diabetes, while collecting the data for diabetes, for children, the data were very limited and we couldn't find a specific prevalence rate for children, but in adults, we could see that it was almost 11% in Nevada only. And also the common diabetes type in children were type 1 diabetes, which is insulin resistant, and then there's a lot of things needed to do for these children. And also for diabetic ketoacidosis, it affects 1 in 4 children is affected by the DKA, which is known as diabetic ketoacidosis. And also the type 2 diabetes in children are increasing as the passage of the time. And they are also at risk of long-term issues like neuropathy, retinopathy, which affects their kidney, eyes, and are also cardiovascular, which affect their heart. So the recommendations that we wanted to present in health interim community and also to policymakers were enhancing data collection specifically on childhood diabetes in Nevada, because we didn't have much data to collect, and we also needed to need to understand the prevalence and risk factors in those children, and also increasing access to healthcare by expanding affordable pediatric services, especially in underserved areas. And promoting healthy lifestyles by implementing school-based programs that encourage physical activity and healthy eating, plus strengthen community engagement by fostering collaboration among schools, healthcare providers, and community organizations to support children's health. And lastly, developing targeted policy to address health disparities and providing resources for managing these chronic diseases in children. And this was my poster, and if you guys have any questions.